Hello, my name is Vincent Creel. I'm the city's public affairs manager, and I'm here to deliver today's Be Prepared report. This is being recorded on Friday, July 10th, 2020 at 6 to 4 in the afternoon. We're going to get insight from Mardi Health Biloxi today, and later we'll see the fascinating story of Biloxi through the years. But first, the numbers. The Mississippi State Department of Health reports that in the past 24 hours, more than 1,000 new cases of the coronavirus were identified statewide. To be exact, it was 1,031 new cases. That's on top of the more than 2,000 new cases that we've seen since our last update on Monday. We should also point out that as you look at that chart, remember that 22,000 Mississippians have now recovered from COVID-19 as of July 5th. Another key number. Today, the State Department of Health reported 11 coronavirus attributed deaths statewide in the past 24 hours. That now means a total of 1,215 deaths statewide since totaling began in March. This chart shows you the 14-day track on cases statewide. In Harrison County, 56 new cases were identified in the past 24 hours and 1 new death was announced. Those 56 positive tests reported in one day is a record for Harrison County. And since Monday, Harrison County has seen 163 new cases of the virus. Also since Monday, we've seen 4 new deaths from the coronavirus in Harrison County. That makes it a total of 15 deaths countywide since counting began in mid-March. That's 15 deaths and 4 of them in the past week. This chart shows you the Harrison County running 14-day average. Notice the direction of the red line, which is an average of daily cases. The continued increase of cases in Harrison County prompted Mayor Gillich to make it official in Biloxi. When you enter a city building in Biloxi, a face covering is now required. That's for the public and all city employees. It's no longer a recommendation, it's now a requirement. As Mayor Gillich was signing that executive order on Thursday, it's his 9th since this crisis began, Governor Reeves was in Jackson announcing that tighter restrictions are coming to 13 Mississippi counties, including Harrison and Jackson counties. The governor has not yet released details of his executive order, but he says you can expect the tighter restrictions will include a mandate to wear masks in public gatherings and shopping environments. The governor has also said social gatherings will be limited to 10 people indoors or 20 people outdoors. Again, the details from the governor have not been issued as yet in an executive order, but he says it's on the way. Please remember the Opening Up Biloxi Again guidelines. These guidelines are more vital today than when they were released back in May. You can see the guidelines for businesses and for you online in just 2 easy clicks, right here on the front page of the city's website and then right here. Take a moment to please look over those guidelines. They are brief, to the point, and written with your health and safety in mind. In fact, under the guidelines that are in place now, employees in nearly all businesses in Biloxi ought to be wearing a mask. Support those businesses who provide a safe environment. And now, this. Joining me now is Tom McDougall, the Chief Administrative Officer of Mardi Health. I should also say that we're recording this on Tuesday, July 7th at about 11:30 in the morning. Good morning.
Good morning.
What's happening at Mardi Health Biloxi?
Well, I wanted to provide an update to you on what we're seeing. We've heard lots in the community and from the state about increases in cases that have been occurring within our county and within our region. And that is true. We're seeing an increase in cases. Fortunately, is compared to other counties within the state, the number of cases per 100,000 population is lower along the coast than what we're seeing in some other counties. But we still have an increase in cases, which is obviously concerning to the community and all of us.
What's your advice to people?
Well, in the hospital, we're seeing a lot more patients test positive, but they're mainly patients that have acquired COVID in the community. They've come to the emergency department or one of our clinics, and they're then testing positive when we run our COVID test. They're able to go home and recover, but we're seeing these increased incidents, which causes us concern. So the best advice we have for those in the community is to be very sensitive that several things are occurring. One is we are now aware that there are a higher number of patients that are asymptomatic, meaning they don't have fever, they don't have symptoms, they're not coughing, but they're still positive for COVID, and they are a risk to infect people that are around them, which could be coworkers or loved ones or even family members. So we need to be sensitive that when you're talking about 40 or 50% of the population potentially being COVID infected yet asymptomatic, we're at risk to others. So I think the best advice that I can give to everyone is what you and the mayor have been telling folks, and that's to wear a mask. Yes, it's uncomfortable. Yes, it's hot, but you're doing it in best interest of your own health and those around you. So someone that is wearing a mask and feels fine may very well be infecting others, and you don't want to do that. So that's the number one thing. Number two is just avoid contact. Be very sensitive when you're going into a store or a restaurant. Wash your hands frequently. If you go into a store and you're using a cart, make sure you're cleaning the handle. Make sure you're using hand sanitizer that's approved for disinfection afterwards. All of those things are going to protect your health and protect the health of those that are around you.
You were worried the last time you were here that people may have been putting off surgery, or not surgery, putting off coming to the hospital because they were afraid.
Yes, we did go through a period of time when we had a lot of concern about patients that were what we refer to as ignoring warning signs. So they're having chest pain, or they're having a headache for a prolonged period of time, or they've got some other health condition that's causing them concern. And we were seeing trends where they were not coming to our emergency department or not going to their physician's office to provide care when they were having these warning signs occurring. So we would have, for example, a patient that would come into our emergency department and they're in cardiac distress, but they would tell us that they had had chest pain for 3 days and had not come to get checked and just come see a doctor. So by the time they were coming to see us, that cardiac distress was causing them to be admitted to the hospital, which they may have been able to avoid earlier. The good news is we're seeing that patients are being smarter about their health. They're being smarter about not ignoring those warning signs. And we're seeing increases in ER visits. Our surgery volumes have kind of returned to normal. We're being exceptionally cautious to make sure that our facility, our emergency department, our surgery department are safe. We're testing all of our patients, making sure that they're not at risk if they've got symptoms. So that has been encouraging. So we're definitely trending in the right direction in terms of patients making good decisions about their health.
Where do we go from here?
I'm really not sure. There's lots of people out there with lots of opinions, but there's not a lot of data still. There's discussions this week about mutations of the COVID strain that may be occurring. I don't know if those are factual. I don't know what we're going to find. What we need is we need time. We need time for the researchers, for the experts to do more and more research to tell us the things we need to know about COVID so that we can manage this long term. I'm hopeful that we'll have a vaccine. I don't think we're going to have one in the near future, so I think COVID will be with us for a while. So the most important thing is what's really most important for all of us every day, not just during COVID, but all the time, is to be accountable for your health. Make good decisions about your health. Be sensitive to those that are around you. Don't ignore warning signs. And be careful. Just because we're hand washing now and being sensitive to not, cough on someone or to sneeze in someone's direction, we should be doing that all of the time. So I think this is kind of a reality check for our entire country and our state to make better decisions about our accountability of our own health and protect others.
And the best thing that we can remind people is that there are a number of unknowns, but we're giving you the best advice that we have right now.
Absolutely. And that's all we really can do is work off the information that we have available and to provide that information and hope that people will comply and they'll make good decisions.
I can't thank you enough. Any closing thoughts?
No, I appreciate you having us. We value our role here in the community as the healthcare provider, and our team is ready and available to take care of patients whether they have COVID symptoms or other conditions. And we just thank everyone for their trust in our facility.
Thank you.
Thank you.
That's our report for today. Please follow the guidelines. Mask up, Biloxi. We'll see you again Monday. We leave you today with a fascinating look at Biloxi through the decades. We'll see you again Monday. Be safe.
In 1810, Biloxi's population was counted at just 420. A year later, after a century of French, British, and Spanish rule, Mississippi became the 20th state in the Union, and Biloxi began to grow. As Biloxi became a popular summer resort, the Mississippi Gulf Coast became known as the American Riviera. By mid-century, Biloxi had become the most important of the Gulf Coast's resort towns. Then, in 1861, Mississippi seceded from the United States. The Civil War had begun. After the war, recovery along the Gulf Coast was slow, but picked up momentum with the arrival of the railroad in the 1870s. Tourists began to return, and distant markets were opened up for a burgeoning new industry, seafood. By 1904, Biloxi was known as the seafood capital of the world. With the demand for labor high, Polish, Acadian French, and Slavic workers came to work in Biloxi's seafood industry. As the seafood and timber industries boomed, this rich mix of cultures was joined by Greeks, Irish, Italians, African Americans, and after the late 1970s, Vietnamese. A wide variety of traditions were born of this diversity. Through the decades, many cultural organizations have regularly held celebrations with contests, food, music, and dance. Mardi Gras, the oldest and most popular celebration, began in 1891. It was held sporadically until 1908, when it became an annual event, with the crowning of the first king, d'Iberville, and Queen Ixalib, Biloxi spelled backwards.
I've known Mardi Gras all my life, and we were always getting prepared. And then on Tuesday morning is when all the excitement and fun began. My daddy would get up at the crack of dawn, we'd load his car, and then he would go out to the boat for King d'Iberville Landing. And then, of course, my mother and my sister and I, we were in charge of the maids and the queen.
For many years, the Biloxi Firemen's Parade, now known as the Biloxi Firefighters' Day Parade, was Biloxi's second most popular event. In 1888, with Biloxi's seafood industry thriving, the first schooner races were held. The races, a weekly event, gained national attention and were held until 1933. Overflow crowds cheered from the Biloxi Yacht Club as the white-winged queens vied for the winning prize, a keg of beer. From 1922 to 1934, the Biloxi Elks Club sponsored a 4th of July celebration that featured bathing beauty contests and sailing races. Sailing regattas were held throughout the summer, some lasting for several days. As in antebellum days, hotels offered boat excursions up the rivers and to the islands, aboard boats like the Pan American Clipper, and later the catboat Gigi, designed and built by Henry Fountain of Biloxi. In the 1950s, Biloxi eccentric John R. Guillotte, known as the Hermit of Deer Island, would row out to meet the excursion boat Sailfish, where he would serenade the tourists on board. Since 1929, the annual blessing of the fleet has been held at the beginning of the shrimping season. As the decorated boats pass in parade, the Catholic priest blesses each one and prays for the safety of the fishermen and for a good catch. And since 1948, the annual deep-sea fishing rodeo has attracted anglers from all over the coast to compete for cash prizes. During the early 20th century, Biloxi continued to grow. Electricity, a street railway system, and telephone service were added. A paved highway was built along the beach, and in 1928, a new seawall was dedicated. More hotels were constructed as tourism increased. After World War II, Biloxi once again became a popular vacation destination. Keesler Army Airfield had survived demobilization to become Keesler Air Force Base, and as other bases closed, Keesler's population grew. Engineers transformed Highway 90 into a 4-lane highway, and at the same time, sand was pumped from the Sound to form a 300-foot sloping beach as a buffer to the seawall. The white sand beach quickly became a tourist attraction for those coming in droves on the new superhighway. New motels, restaurants, and nightclubs sprang up along the beachfront.
My most vivid memory of coming down that beach highway was on a Saturday night, and it was sheer lights. It was the Broadway of Mississippi. There were so many places. Music abounded here on the coast.
Two well-known spots were Gus Stevens' Seafood Restaurant and Lounge and the Cabana Beach Motel's Fiesta Lounge. Stevens booked big-name entertainers, and some entertainers who were relatively unknown at the time.
The first star that I really remember was Dave Gardner. He was sort of the Southern Lenny Bruce. He, in his heyday, would draw more people into the nightclub than any other performer. There was standing room only when Dave performed. There were others like Mamie Van Doren and Jerry Van Dyke and Jane Mansfield, of course, and then Gene Warren, the Four Mints. So there are a lot of people that actually started on the coast here. There are many singing groups that began with Dad. Tex Ritter sang at Dad's restaurant, Mickey Gilley, Elvis Presley. Actually, Dad met him and told him he would never make it in the business.
Size Place, an inland nightclub popular with the locals, brought in Hank Williams Sr., the just-beginning Elvis Presley, and Jerry Lee Lewis, who, in keeping with his onstage style, practically tore up the piano. During this time, Jimmy Love Jr. began marketing his White House and Buena Vista hotels as potential convention centers. Others followed his lead, and Biloxi became a convention destination as well as a mecca for tourists. Then, in 1969, Hurricane Camille wrought destruction on the Mississippi Gulf Coast. In the wake of the storm, the people picked themselves up and began to rebuild. Biloxi's economy recovered slowly until 1992, when the state of Mississippi legalized dockside gaming, igniting the biggest economic boom in Biloxi's history. Then, in August 2005, Hurricane Katrina brought all of that to a standstill. Katrina hit the Mississippi Gulf Coast with high winds, heavy rains, and a 26.5-foot storm surge, causing massive damage to the area and killing 53 people. 5,000 businesses and homes in Biloxi were destroyed. As they had throughout history, the people of Biloxi would gather the strength to rebuild. The Beau Rivage reopened just 1 year to the day after Katrina. Today, Biloxi is once again a major vacation destination, offering a wealth of outdoor activities, outstanding seafood, and casino gambling.
Welcome to Biloxi.